we recommend that people go read your article in Pandemic Discourses, the one about, I think it's called A Visit.
Pandemic Letter from Tokyo.
Yeah, a diary, yeah. But one of the things I think you sort of play around with is like, what is the role of the state? And you just said the Japanese state is quite weak. But I just saw, since your article, Japan actually, they have announced some kind of curfew and lockdown that came with some penalties. I mean, can you say like how that's working out?
Well, yeah, I mean, I think that they've imposed this state of emergency that has imposed that. But, you know, there are a lot of debates within Japan about the whether the government, what level of authority the government should have for imposing fines and things like that. And I just want to emphasize that, you know, in this comparative perspective, it's really interesting to see how lockdowns are being enforced and implemented, because as I mentioned already, you know, the countries of Asia have very, very different strategies, and not every country had a lockdown. They also have very different kinds of state. And, you know, I think Vietnam, for example, which is considered to have a very sort of a strong interventionist state, I don't think they really had a lockdown either. So maybe they didn't need it, I suppose. Taiwan is a country that is very well, you know, known for for having had a good effect on good record on keeping the pandemic under control, and they are extremely participative in the way that they have developed mechanisms, developed norms and things like that. And so, I mean, I think we just have to go beyond this, you know, black and white categorization of authoritarianism versus, you know, democracy or whatever. I'm not sure that regime type makes that much difference. What might what we're seeing is that a variety of approaches with citizens' participation, consultation with citizens, communication with citizens. You know, a lot of people have commented on the use of like historical, cultural imagery. My students in my pandemics class in the fall were wonderful because they wrote a lot about different countries. And, you know, apparently Norway, the leaders would write about, you know, national emergency in times past. Similarly, you know, the Prime Minister of New Zealand, you know, called on national unity and things like that, in the same way that all these countries of Asia have done. So I think it's these capacities of leadership to inspire national unity, I think, is obviously something that's been highlighted everywhere, and that's kind of evident in many of these countries in Asia. So I don't, you know, I think what's interesting in looking at the countries of Asia is because they include such a range of characteristics in terms of their political systems, in terms of their economic systems, in terms of their cultural background, their history, and all of that. And I don't think that, you know, looking for this cultural and, you know, explanation or regime type explanation is particularly helpful. But and I find it very unhelpful, particularly because you can't fix that, if you know what I mean. Particularly in the overnight, and we need an overnight solution to the ever spreading and mutating virus.
So for you also in that same essay, based on the research you did in Asia, you argue that based on what you observed there, that COVID-19 has exposed some key gaps in national and global institutions that require priority attention. And you, in the article, you isolate like 3 of them. Can you just talk a little bit about like those 3 ones that you think really we need to move on?
Yeah. So I think of the pandemic as a human and social crisis, not as a medical crisis, right? I'm a social scientist. I'm an economist. I'm not, I'm not a public health specialist. I'm not a medical, I'm not an epidemiologist. Um, and so it's not enough to stem the pandemic. You have to address the socio-economic consequences, right? And I think that there's a consensus, in fact, that the pandemic is exposing, amplifying inequalities of various kinds, and actually showing how the existing structural inequalities are just kind of playing into these social consequences. And so, at the level of these countries in Asia, South Asia, and East Asia, I mean, you're exposing how the lockdown, for example, affects people differently. The lockdown, I mean, we know, living in the U.S., in New York, whoever you are, that women have been very adversely affected by the mounting, tasks of childcare and multitasking childcare with paid work and all that sort of thing. So there's a gender dimension to that, but much more, the socioeconomic inequalities in access to healthcare, the social determinants of health, that have meant that any impact, health impact, has been disproportionately felt by lower income people, by minorities, ethnic, racial minorities, and marginalized people, and migrants, and so forth. But I think about this in the global setting, and let me go back to these national issues, and I don't think that you can say that these Asian countries have been successful, because I don't think that they have given enough attention to these unequal impacts of not just the pandemic, but affects the way that it has affected the way that the policy measures that have kept the pandemic down has affected different people. So, not just the lockdown, but all kinds of social and economic consequences of the global recession. So there are basically three kinds of effects on people. One, the actual health, catching coronavirus, catching COVID-19. The second is the effect of the lockdown and other measures to contain the virus. And then third, the global economic recession. And all of these each of these actually has had unequal effects. And that's very well documented by all kinds of studies, by all kinds of people. But I think I just want to take it to the global level, where you see these global inequalities playing out and the failure of global institutions. So, I look at the global economy in terms of the way that people engage with it through global value chains. And workers in the global economy in the global south are basically doing the low wage, low skill manufacturing and production work. Garments is a classic example of that, so electronics and, things of that kind. And when the pandemic hit, of course, their vulnerability is exposed, and in that they don't have the bargaining power to not be the first to be laid off, or migrant workers, for example, maybe they have the most precarious forms of employment arrangements, and they may be the first to be laid off. And so in the global setting, those workers doing the most low-paid work tend to be the ones who are laid off, because demand has come down, global demand. When the pandemic hit Europe, Then in North America, then global demand, for example, for electronics or for garments went shooting down, and then the brands canceled orders, actually didn't pay for the orders. The factories employing the workers couldn't pay the workers, and they got fired without any sort of compensation. So, I mean, that just shows you that these structural inequalities in power and bargaining power is what leads to the vulnerable people being most hurt. So the gaps in national and international institutions that ensure that workers' rights, human rights to work, to decent work, are enforced and implemented. That corporations actually have responsibility to comply with those international human rights standards, I think, is what makes this pandemic extremely unequal in its impact on people.